If you're a parent of a child aged between 3 and 12 who is a current NDIS participant, and you're still waiting for real support to start, then I want you to know that you're not the only one. You've done the hard part, getting the plan, chasing the calls, chasing the referrals, and yet everything still feels stuck. If this sounds like the experience that you're having at the moment, then you're in the right place. I'm Karen, the owner of the Child Health and Development Hub, and I run a small team who works with families every week, just like yours across the Mid-North Coast. We work with children and families aged 3 through to 12 who are current NDIS participants, and we focus on what matters the most. Face-to-face supports that start quickly, feels personal, and actually helps your child grow. The reality of being an NDIS participant for many children is most families have been on waitlists for months before they find our service. Some have even been on waitlists for over a year and all but given up on accessing the NDIS for their child. They have the funding, but they don't have any supports in place. Or they've been told by every service that they have accessed, we're not taking referrals right now, we'll add you to our waitlist, never to be heard of again. And the longer that this drags on, the harder that it gets. For the child specifically, but for the family as a whole also. The reason that I started the Child Health and Development Hub sits within this exact pain point. Before starting this service, I worked for close to 20 years in health, and the role that I was in before starting this business was actually about helping families navigate and gain access to the NDIS and local support services. Every week, I met with parents who were doing absolutely everything that they could to try to connect their child with specialist support services, and they were still falling through the cracks. I remember at the time thinking it shouldn't be this hard for children to be accessing help, so I decided to build something that worked differently. And that's where the Child Health and Development Hub was born. We provide child-specific NDIS support across the Mid-North Coast to families who are living between Kempsey and Coffs Harbour and everywhere in between. We deliver supports at home, at preschool, and at school. These are called place-based supports, and we know that they achieve the best outcomes for children. Each family gets a dedicated practitioner who works with their child every single week. They are your primary point of contact. And once you're on board, you can access our full team, including care navigation, occupational therapy, psychology, and education-specific support services. And no, we don't do long wait lists. You see, we believe that wait list is more about the constraints of a business and the inability of a business to be adapting to a change in demand. We keep our waitlist at a maximum of 4 weeks, with most families being connected with a service and starting services within 2 to 4 weeks. We currently provide over 70 hours of individualized childhood supports each week. That's thousands of hours every single year. And these are the reasons that families feed back as to why they choose our service. Families love that they have a real person that they can connect with who responds to their concerns via text, via email, via phone call. Families loved that they could access support within weeks, not months, not years. Families love the consistency of the team, not a revolving door of providers. Families love that we can provide a clear, focused solution and path for their child to achieve their goals. No overwhelm and no confusion. If this sounds like a service that might be the right fit for your child, then the next step couldn't be more simple. Simply click the button below this video and fill out our contact form. Once we receive your inquiry, we can organize a time that suits to have a free parent phone call where we can discuss your needs and determine whether or not our service is the right fit for your family. There's no pressure on this phone call, there's no commitment that needs to be made. Just a chance to talk through what your child needs, what you've tried in the past, what's worked, what hasn't worked, and determine whether or not our service can meet those needs for your family today.